Okay. Hello, everyone. I am Shannon Wise, and I am here with my intern, Amy Avillian, and we are from the Anxiety and OCD Treatment Center of Central Pennsylvania. We are going to be talking about anxiety disorders and OCD. This is a presentation that is for schools and for teachers, nurses, school counselors, any professionals within the school systems, and just to help you to be able to identify the signs and symptoms in your students and how to help them, just some tips to help them. Go ahead, Amy.
All right, so we're going to start off with just the definition of obsessive compulsive disorder. So OCD, it's a serious mental health disorder. So what happens is the person gets caught in a cycle of obsessions and compulsions, and it can become so extreme that it actually consumes a lot of the person's time, and it gets in the way of them living their normal life, and it gets in the way of their important experiences and them living according to their values. So obsessions and compulsions. So obsessions are the thoughts, images, urges, or impulses that occur over and over, and they feel outside of the person's control. So those are the kind of intrusive thoughts that happen that then lead to the person performing the compulsions, which are the behaviors that a person uses with the intention of neutralizing, counteracting, or making their obsessions go away. So usually that includes avoidance, reassurance seeking, or reviewing or checking.
So some of the common symptoms you might be seeing in your students are anger outbursts, being distracted, disinterested, even them appearing lazy. They might also be busy. The reason for some of these things, they might be busy focusing on their nagging urges and completing rituals to relieve distress. And that might just be internal, like they might actually be reviewing a situation that occurred, an interaction with someone that they are going back over in their mind, where it just looks like they're not paying attention. So they may seem unfocused and unable to concentrate. They may exhibit repeating behaviors, such as walking in and out of a doorway or getting up and down from a chair. And this might look like disruptive, just behavioral stuff that sometimes I think might be thought of as ADHD. I do hear this a lot from teachers or parents as one of the ways that OCD will show up in school. Another aspect of OCD that happens with school is getting stuck with writing, reading, or checking for mistakes. So students will sometimes need to reread something repeatedly, or rewrite something, or erasing excessively, or just rechecking their work for mistakes before submission in an excessive manner.
So as Shannon mentioned before, some of the symptoms of OCD can look like other disorders, often ADHD. As well as, just acting out or general, bad behavior. So it can be difficult to identify and diagnose. So OCD, it often changes in nature or scope from one set of obsessions and compulsions to another with a lot of differing behaviors. So the symptoms can worsen or seem to disappear, often for no obvious reason. So yeah, it can be very difficult to identify because it's not always the same. Sometimes there are different different behaviors, or sometimes, it seems to kind of calm down a little bit over time and then, worsen again a little bit later. So, yeah. So students often in school, they can experience overwhelming anxiety or strong urges. And sometimes this feeling is described as mounting anxiety or intensifying urges, as if they were like a rising volcano or a tea kettle about to boil. And so the relief only comes when the pressure is released, which is usually the compulsive behavior that they may be exhibiting, and that may seem disruptive to learning and possibly to the classroom. And this is all really important because approximately 500,000 people in the United States are living with OCD. So this equates to roughly 20 or so students in an average American high school who deal with OCD on a daily basis.
So now we are going to go over anxiety disorders. And the anxiety disorders include, the ones that we will speak to are generalized anxiety disorder, referred to as GAD, social anxiety or social phobia, and separation anxiety, panic disorder, and specific phobias. The specific phobia that we will refer to is emetophobia, which is the fear of vomiting. And these disorders often involve excessive worry and fear. Anxiety is often in anticipation of a future concern and is commonly associated with avoidance behaviors. It does affect job performance, school performance, and personal relationships. Symptoms of these anxiety disorders are frequent excessive worry, not feeling well, missing school or class. Often these students are asking for passes to go to the nurse's office or to go to the guidance counselor, go to the bathroom frequently. They often exhibit symptoms of stomach aches, headaches, fidgeting, acting shy or not wanting to talk in front of others, crying or missing parents or their caregiver when they are away from them. And fear of vomiting would be related to the emetophobia that I mentioned. Like I said, frequent visits to the nurse's office, difficulty falling asleep, staying asleep, or just sleeping to avoid.
So here are some common ways that you can help as, a staff member of the school. And we know that you guys are overwhelmed every day with all different types of, issues, and your job is hard enough. So here are just some simple things that you can do to help students who may be exhibiting some of these behaviors. So as we mentioned before, one of the symptoms of OCD and various anxiety disorders are reassurance seeking. So it's important that when you are interacting with a student who may be exhibiting these behaviors, that you encourage them, but try not to provide them with the reassurance that they're seeking for, or that they're seeking. It's important that we encourage them to return to class, and kind of let them know that it's okay to feel your feelings, encourage them to sit with that anxiety for a little bit, kind of wait it out. And then it can also be helpful to provide information about anxiety and OCD, because it can be really empowering and helpful for them to understand what's going on, because these behaviors can be, these feelings can be scary, and they may not really understand that this is, a disorder that they may be experiencing. And then, just ask them how you can help, ask them what they need from you. And then, another thing is to provide fidgets and short breaks to students that need them. Yeah. And so some more ways that you can help is to collaborate with parents, therapists, and other teachers, especially within the school, because the kids, are there, students are there for 8 hours a day. And so it's really important that you're all kind of on the same page with, the parents and other teachers and other support staff. And providing support through offering outside resources, which we will be discussing a little bit later. And then providing information about cognitive behavioral therapy and exposure and response prevention, which is ERP is kind of the gold standard for treatment in OCD and anxiety. So it can be important to know a little bit about that and give them a little bit of information on that as well.
So we have created a list of resources for you to refer to and to offer to your students and their families. On the first page here, we have listed the International OCD Foundation, which is a wealth of information related to OCD and resources related to OCD, sometimes live events, an annual conference for folks with OCD and professionals. And then there's also body-focused repetitive behavior resource here, which also is a great resource. And then we have the Anxiety and Depression Association of America. Again, another great resource for anxiety and OCD information. And then we have some additional websites. So the OCD Stories is actually a podcast and has many OCD experts. So if you want to familiarize yourself more, there's wonderful information on that. The emetophobiaresource.org provides information for folks suffering with emetophobia. And then at parentingsurvivalseries.com, that is a website from Natasha Daniels, who is an expert in working with children with anxiety disorders. She has a YouTube channel and I think she might do a blog as well, but she also has a podcast. Excellent resources, videos for kids. So she's one to check out. The next page here is just a list of books that have been helpful in my practice and to my clients. Just to highlight a couple of them, I would say The Happiness Trap by Russ Harris is an excellent resource of acceptance and commitment therapy and very user-friendly. Another book is When a Family Member Has OCD by John Hirschfield. Awesome book. I mean, all of these are great. So I don't know if there's any. Amy, do you have any that you have looked at or used that you feel is like you must highlight here?
The Happiness Trap.
Yeah.
That one is, that's one of the first books that I began reading when I began working with you, Shannon. And I think it really just helped me understand the idea of, accepting our emotions for what they are and kind of sitting with our anxieties and sitting with that uncomfortableness that we feel that we're constantly, trying to get rid of. So that's the one that I can really highlight.
Yeah.
So, yeah.
Thank you. The other book I'll say one thing about is Breaking Free of Child Anxiety and OCD, a scientifically proven program for parents by Ellie Leibowitz. He is an expert at the Yale Child Study for Anxiety Center. I think that's what it's called. But his program it's called SPACE. So it's supportive parenting for anxious childhood emotions. So that's something even to refer parents to, an excellent type of treatment for parents who have children with anxiety. So anyway, that book is listed here as well. And then I think our final page of resources here for you guys is it's some inpatient residential treatment facilities. We do have space treatment listed there if you do want to learn more about that. McLean Hospital in Boston is really the premier OCD treatment facility. University of Pennsylvania has outpatient anxiety treatment. So these are just more severe cases for people, like if people really need more intensive treatment. So anyway, we've listed these here for you if there is a need for that. So
thank you for watching this video, and we hope that some of what we talked about today will be helpful for you. And if you have any questions, you can always email us. Our emails are listed down at the bottom. And anything else?
I have nothing else. Yeah, feel free to reach out. My practice website is thisocd.com. You can look at what we offer. And you can also just email us if you have questions or information on us teaching you anything else. We would be glad to expand on this. So thank you for attending.